Hi, you all, and welcome back. We are here to talk about health equity, and health equity is definitely not a trend. It is such an important topic and goes right along with our theme of Black health and wellness. We really want to dive into the topic, let you all know a little bit more about what health equity is, how it intersects with different areas of well-being, talk about technology and health, and even talk about it a little bit from the commercial side. So I'm going to introduce our panel. We have Dr. Othelia Pryor with Michigan Medicine joining us. We have Phil from Project Healthy Minds. We have Louis from VMLY&R, and Rego will also join us from Walgreens. So with that said, Dr. Pryor, I want to start with you. If you can provide us just with a general understanding of what health equity is.
Okay, well, let me tell you what health equity is. The first part is it's a compound word, and it's described of two elements, one health and one equity. And what I like to say about health, I like the World Health Organization, which says that it's how you fit into the culture. And it is also just not an absence of disease. And equity is different than equality. A lot of times people think they're the same, and they're not. So if you put the two words together, the definition that you have with health and equality is that everyone has the opportunity to be as healthy as possible. And we're looking at this from a population group, not an individual group. So we're looking at populations in our society. And so we want everyone to be healthy, regardless of their class, regardless of their race, which, by the way, is something we've constructed. It isn't biological at all. Where they live or any of those kinds of barriers. And locality also shouldn't matter. It shouldn't matter where you live, but it does. There was a study that showed in Moraine, California, that there is a 15-year difference of life expectancy between two communities that are only 8 miles apart. So
Wow,
that
that's
leads you to
major.
the question, pardon me?
That's major. Just 15
Well,
miles and that much of a difference.
there's a huge difference in the community where I live in Michigan. In our county, we have a 4-year difference between two communities that are predominantly white and predominantly Black. So that's all over the nation, not just in California, it's everywhere. And so if you look at the difference in life expectancy, that leads you to the question, and it says, well, what in the world is impacting health to see those differences in life expectancy? And that's what's going on. And that leads you to the discussion of what's going on, which is the social determinants of health.
And how do the social determinants of health factor into the concept of health equity as a whole? How does that factor in?
Well, the social determinants of health are really important. And I want to tell you this, even though it may be a new term to some of you on this call, it isn't a new term. In 1899, W.E.B. Du Bois, who was an African American sociologist, wrote about health disparities in his community in a book called The Philadelphia Negro. And so it's not new. And so, health equities are embedded in neighborhoods. And if you drive around America, you can see the difference in neighborhoods and the life people live and what they do in those different communities. And so we have a formal definition, though. The formal definition is the conditions in which people are born, grow, live, work, and age. And then we add to that, and this is shaped by the distribution of money, power, and resources. And if you look at our communities, you can tell when you're in a high income community or a low income community. And you can look at see the types of jobs people have. If you look at all of these social determinants of health, this impacts the health of our neighborhood. So then that begs another question, which says, well, what determines the differences we see in these neighborhoods? And that is shaped by policy. Policies sometimes are laws, policies sometimes are unspoken, policies sometimes are just culture mores. What do we do? Is this the way it's always been done? It's
Yeah.
expected. And so those are the things that really impact these social determinants of health. And if you dig a little bit deeper, you'll find out that these are impacted by policies. Policies, culture, laws, all of these things are embedded in who has opportunity and who doesn't have opportunity.
So a lot of
So
it
that's
sounds like you're saying a lot of it comes back to law. Law impacts so much of what's going on in health in general.
a lot of it does come back to law, but not all of it. Some things are just customs. And what people have done to discriminate against Black people, they've taken customs and they've enacted them into laws. And we have de facto segregation. In some places, it wasn't a law in the North, but you knew where you belonged and you knew where you were accepted and you knew where you weren't accepted. And so these things they're caked into our society. They're built into our society. And for African American people, it really has determined the opportunities that we have and the advantages or the disadvantages that we have. We have 400 years of seeing this baked into our society. So the problem is that this impacts the health of African American people in America. And any measure you want to look at, health disease, any disease you want to look at, strokes, diabetes, anything, African Americans' health is abysmal. The only group that fares worse than us in many cases are Native Americans, and we know what happened to them. And similar trauma happened to us as well. So if you look at these traumas, we carry this trauma in our bodies. And these
Okay,
and the
some of
bodies.
that trauma comes out even in what affects us health-wise, right?
Well, yes, it really does. The trauma that we carry, research has shown that stress, wherever it comes from, and being a person of color in America, especially a Black person, is very stressful. And that is baked into our DNA. And the worst part about it is that it's even can be passed on through generations. We have intergenerational stress. And that's one of the reasons that the health of African Americans is so poor when you look at us as a population group. Now, there are exceptions, but we're looking at the general population, and that's what's going on.
Wow. Yeah, that is a lot. And I think there's like some other parts of the social determinants of health as well, not just the stress, but maybe education and some other things. If you want to tell us a little bit more about those as well.
Well, education, as you can see on the graph, that is one of the social determinants of health. And education to me is premier because it describes the kind of income you're able to generate. It describes the kind of place where you're able to live. It describes the kind of work that you do. I mean, in COVID, many people of color contracted COVID because they couldn't work from a computer. They had to go in. It was the type of job they had. And so education is so critical. It even determines the type of school you go to because school funding is tied to housing and housing is tied to discriminatory laws and funding and mortgages. And so it's kind of a place where everything's kind of all put together. And so it impacts us. It's like I call it a whack-a-mole game. You hit one thing and you try to help education and something else pops up.
It's
and
like at the
all
fair,
of that,
right?
yeah, all of that impacts our health. All of it does.
Now, with health equity being such a long-standing issue, why should we as a nation care about health equity, and maybe even what can we do to make an impact on a personal level?
Well, I'll tell you, why should we care? There's two reasons for me. There's a moral reason and there's a cost reason. And I'll talk about the second one first, and that's cost. Inequality cost the American system money. It cost us money. There was a study done by Louis in 2011, and it was said that the inequities that he calculated, and this was done between 2003 and 2006, cost $1 trillion a year. If you consider the lost productivity, and this was all people of color, well, not all people of color. His study was done on Black, Asian Americans, and Latinx people, but that's how much money it cost. And so W.K. Kellogg just did a study, and they said that health inequities cost the United States $93 billion a year.
Wow.
That's a lot of money. We can do something else with that money, but we have these inequities and we have to fuel them. And then the moral issue, everyone doesn't always look at the moral issue, but I think that's important too. And the morality of it is this. It impacts all of us. It impacts our nation. It costs us money, and it diminishes the humanity of people who are experiencing this. There was a study that was done in 10 cities, 10 of the most populated cities, and they were just looking at the inequality of Black people. And they were looking at excess death. And that's a term that basically says if a person was white, or if we didn't have inequality,
Thanks.
what would their health be like? And they calculated that in these 10 cities alone, on an annual basis, 74,000 people that were Black died every year because of inequality in healthcare. And if you want to put that in something that you understand, that's like a 247 jet filled with nothing but African American people crashing every other day for years, and there'll be no survivors.
Wow.
That's what that translates into.
That's
And
a lot.
that's a lot. It's really unbelievable. And so, as a country, the question I have is yes, we see it. Yes, we've talked about it. Yes, we've counted, and we've counted the cost and the morality and all of these things. But do you have the moral fiber and the political will to do something about it? That's my question.
Thank you so much, Dr. Pryor. That was just a great overview and just so important for us to care and some things we can do. I'm going to bring Phil to the stage because for a couple of reasons. You talked about trauma being a part of some of the social determinants of health. And also we saw that great video from Project Healthy Minds ahead of the session with Tiana and Nikisha. And Phil, we really wanted you to join us to talk about how mental health kind of has intersectionality across all aspects of health and what it has to do with health equality as well and health equity.
Well, first of all, thanks for having me. And Dr. Pryor, as a fellow Michigan alum, I got to say, go
no,
blue.
Here we go.
Before
Here
I
we
do
go.
No, but-
you know I'm a green and white type of girl, Phil. You know I'm a green and white.
Yeah, I know. I had to get it in before I got into my
did.
answer. Look, you know, when we were talking about it, I was saying the other day, you know, my view, I come at this through a mental health lens. Project Healthy Minds is a technology nonprofit that's trying to increase access to mental health services. And, you know, the way that I believe that mental health is one of the most intersectional issues that exists today. And, you know, when you think about it, if a family doesn't know if they're going to be able to put food on the table or pay the rent, yes, that is a financial security and an economics issue, but that creates toxic stress for families, for parents, and for kids, right? If you turn on the TV and you see a young Black boy killed because of the color of his skin, yes, that's a civil rights issue and a police brutality issue. That creates trauma for communities of color, right? If you are concerned about a warming climate and it means you're going to put off having kids, yes, that is a global warming issue, but that is also a mental health issue. And so I think, you know, if you look at the mental health space historically, it's been so stigmatized that I think we oftentimes forget or overlook the fact that so many other issues in society have a mental health undercurrent, that there is trauma that either informs the experience or that is caused by the experience. And I think part of what the opportunity, I hope, is in as we sort of enter, I guess, the third year of this pandemic, is
Can
that,
you believe that? Can you believe we're already
which is hard to believe.
Yeah.
But there is something, what I will say is, you know, you basically had this gigantic social experiment in social isolation. And I think it's forced a lot of people, including a lot of people who are skeptical around mental health historically, to confront their own mental health in new ways, to think about this issue in ways that they haven't before. And I think that's part of what the opportunity is moving forward. You know, in the United States, you have more than 65 million Americans who have a mental health condition. That's 4 times the number of people diagnosed with cancer. And despite that prevalence, 60% of people don't get any form of mental health care. So you talk about health equity. We have a gigantic issue in the United States. And if you even look at a couple of weeks ago, the Surgeon General put out an advisory on youth mental health. And if you ask the question, okay, well, does race, does economics really compound when it comes to mental health? There was a shocking set of stats in it. One was that if you looked at children under 13 in this country, Black children under 13 are have double the likelihood of dying by suicide as compared to white children. And if you look at it through an economics
number, double.
Crazy number, double. And if you look at it through an economics lens, across all kids under 18, kids who grow up in poverty are 2 to 3 times more likely to develop a mental health condition as compared to kids who come from wealthier backgrounds. So to me, you can't look at these issues in isolation. They are intersectional in their nature.
And I guess I'd say even obviously if the poverty is twice as much, you have to say that's access to even getting care for your mental health,
Yep.
right? Like, of course, you might have more suicide or things like that if you didn't even have the resources to get any help or counseling. And then I even think about just getting mental health help and like homelessness, right? We know that a lot of our homeless population suffers from mental health issues. And with that said, then you're not going to have like any shelter, which means you're not going to the doctor, and many other health issues can come into that. And that definitely plays into health equity.
Right. I think that's part of the, it's funny. Early in my career, I had spent time working on the economic policy team in the Obama White House. And I remember one of the stories that my boss, Gene Sperling, had said on like my third to last day. He told a story in a meeting about the difference between when you're short-term unemployed, when you're just between jobs, and when you're long-term unemployed. And he told a story about how when you're short-term unemployed, you might be behind on a rent payment. You might have to downsize you may not be able to go out to eat as much. You may not be able to go on a vacation until you find your next job. You make some changes in your life, but they're not fundamental. You go 18 months unemployed and suddenly you've lost your house, right? And your marriage starts to fall apart. And the question becomes, what happens to your kids? And suddenly the burdens that are placed on people become that much more intense. And he told the story for a different reason, but I think that it exemplified how interrelated all of these issues are. Yeah, if you are suffering from a severe mental health issue, it makes it a lot harder to stay in a job and to get the right kind of job for you. But also the opposite. If you've lost your job and you know how expensive it is to access mental health services already, and you suddenly don't have a job, or you don't have health insurance, or you don't have the same kind of private health insurance you used to have, suddenly the barriers become even greater and greater. So yeah, I think what you're saying is exactly right, Brandee.
Yeah, thank you so much for that, Phil. And talking about the intersectionality, I'm going to bring Louis up because we've talked about what the health equity is. We've talked about mental health and things like that, but we also talked about access. And Louis, what you really specialize in is talking about how technology meets equality in healthcare. I want you to shine a little bit of light on that because it sounds like, health equity crosses so many different paths and different parts of life. So let's talk about that from a technology and design standpoint.
Yeah. Thank you for having me, Brandee. And I have an echo. Is everybody's mic muted? Sorry, that's the audio engineer in me. I'm like, what's going on here? But in general, so as we start thinking about equity, we start thinking about how that associates with design, how that basically translates into technology. It becomes really important for us to start thinking about what are some of the dependencies that people may have. Again, as Phil just talked about, like, when you don't have access to certain tools that are now being used and adopted to help you. For example, if I need to go to the doctor or to the pharmacist and I have an experience that requires me to use my cell phone to have a augmented reality virtual pharmacist that's going to lead me to the right, prescription or the right over the counter. Well, if I don't have the finances to afford that kind of phone, I'm basically, excluded from that experience. So it becomes important for people to, designers, for technologists, developers, when we start really thinking about these solutions that we're creating, like, it's very important for us to approach these things from a responsible innovation standpoint, approach it from understanding, again, the dependencies, ask questions such as like, who is the most excluded from this experience, and then solve for them. And that's how we can really leverage best of human-centered design and how that applies to, again, our overall design process and technology and things of that nature.
So it seems like even in the design portion of it, the health equity should be a consideration. So not just coming out with a product, but as you're developing the product, all of this should be included in the thought process along the way.
It has to be, because I mean, there's no other way that you can have an equitable outcome that most people can really benefit from. Because at the end of the day, as a designer, you know, our goal is to add value to people's lives. Arguably, that's every discipline, but you know, kind of getting back to what Dr. Pryor was talking about, a lot of the stuff that's created in our society, from the lens of a designer, everything was done by design. So in order for us to change that, you have to kind of take the mindset or the mantra of change happens by design. So you have to be willing to sit down and again, really think about if we're going to use AI or artificial intelligence or machine learning as part of our product solution, well, you got to ask questions like, well, is this data set that we're using to train this algorithm, is there bias? Where, and more than likely it is, but where does that bias come from? You know, and
so even the algorithms get us, huh? The algorithms are already putting people behind.
Yeah, I mean, there's a thing called algorithmic bias, and it's a real thing. And that's why you have instances to where things like facial recognition software does not identify people with dark skin or women, or you have instances to where kind of tying into the health aspect, to where, you know, doctors or cardiologists are using AI to help them diagnose a patient, but the majority of the database that taught that machine is based off of largely white population, and there's certain discrepancies or things that can be different amongst populations, and now a person gets misdiagnosed. All these things are impacted from the design and development process, which, you know, it's not the technology's fault. It's definitely not. At the end of the day, the technology is a byproduct of humanity. So it's a human issue, not a technology issue.
Thank you for that, Louis. And I think some of what you said goes right into, with the design idea, goes right into our discussion that we can have with Rego. Rego, I wanted to ask you, as the head of creative of Walgreens, and thank you for being our partner and thank you for being here. What kind of things is your department doing to make sure that when you're coming up with these designs and rolling things out to the public, that you have health equity in mind, and just the fact that Walgreens has kind of changed from being what we knew as a pharmacy, but to being more of a whole healthcare partner. Can you talk to us about that?
Sure can. I hope that you guys can all hear me.
We got
technical
you.
difficulty. You got me. Okay, great.
You're here.
First and foremost, thank you for sitting me on this panel. Being in a room of like super intelligent people makes me feel just that much more in need of more studies. However,
no, don't say that.
I sit right in the middle, like Walgreens sits right in the middle of this conversation, right? You sort of launched into a bit of how I was thinking about, you know, coming to this conversation around our transformation, our transition from a retail pharmacy organization to a healthcare company, which makes a whole lot of sense if you think about where we are, our scale, how we actually really and materially can positively affect health outcomes. I don't know if you guys know this statistics, but we are within 5 miles of almost every human in the United States, which makes our reach pretty massive. And so
I think that's important. Thank you for sharing that, for sure, because you are in the communities, right?
We are not just in the communities, and I say this all the time, we're of the community. So the folks who make up the stores are actually people who live in the communities that those stores are serving. And so, you know, there's an extra special level of care that is embedded in our DNA as, you know, just the, you know, your corner druggist, because that's where we started, and how we think about, and I'm going to get back to the question about my team and how we built ourselves around human truths and understanding humans at our core. But, you know, again, the Walgreens family, you know, their name is on the building. They were the local, druggist who knew their community. We've grown up, obviously, since the first store here in Chicago. At our scale, it's gotten a lot harder to know the individuals that come in and out of our stores or experience us through our digital ecosystem. So my team and what we're doing on the Loop, which is our creative studio, is actually sitting people from the community in creative conversation. So one of the sort of signature pieces that we built last year under COVID, the cover of COVID, was a writer's room, which follows more like a production in television than a typical marketing advertising setup. But basically, the concept there was to put humans at the center of the conversation that looked like our customers, right?
Okay.
So to hear from them, to break free from our biases, right? Because we all have them, and you guys mentioned a few of them here. And so our sort of model for the future is to not only get the insights from research and analytics, but to actually put humans who are experiencing things like negative health outcomes in a room to really sort of deliver those truths from their first person perspective on
I love that you all are going to get people who actually represent the community to be a part of these conversations. It's not just a whole bunch of executives in a room or all people who look the same in the room, but actually getting some input to make that an intelligent way to develop what you're rolling out.
And not to sort of put a positive spin on the pandemic, but I think the pandemic in some ways, while it shined great light on all the inequities, it also allowed us to think about bringing the entire country together remotely, right? So that I am a firm believer that things happen for reasons that are beyond our abilities to understand. And I think this remote workforce that we're now sort of we all have access to has allowed us to convince executives that may have not been all that comfortable in bringing those rooms together. We don't have to actually have a physical room to bring these folks together, which has been a real pleasure to see people literally living in those communities across the country, sitting with us, communicating.
Right, because you're not coming together in person anymore, so there's no excuse to leave people out, right?
Exactly.
I love that. I think that I'm going to open that up to the panel. What other things do you all see that are some areas that health equity has grown because of the pandemic? If any of you want to answer that, maybe Dr. Pryor, you have some insight of maybe some things that having the light shined on it has been able to help us take a step or progress to something for improvement.
I appreciate everyone on this panel. And what Rego said about having real people involved, what the pandemic really did was shine a light on the inequities. Even Fauci made that comment. And in Michigan, our governor has instituted policies, and they said, and people were saying, my gosh, I didn't know. And my response was, you weren't paying attention. It's always been this way. That's why you didn't know, because it wasn't important to you. So that has really helped in that instance.
I love that. That's really good. That at least, like you said, the awareness is there. And Phil, I'm sure that you can say, I hope that there's something that has happened or helped with like mental health awareness or maybe even access to help for people through the pandemic, because I know that I think the pandemic has like opened up people's eyes to maybe mental health more than ever, in my opinion, but I could be wrong.
Yeah.
Oh, Phil. Let us get it worked out, and we'll get you back on in a second. But Louis, have you seen any changes or developments from the pandemic?
Yeah, in general, like everyone else has said, it's been one of those situations to where the pandemic has shined a light on a lot of the disparities. But on more of the positive thing, what I'm starting to see just in terms of equity in general, right, is that more people, especially younger generations, they're not putting up with a lot of the stuff some of us older people are. They're opting out at mass droves. And it's something I think is that all of us should be inspired by. People tend to look at young people. I'm saying it like I'm real old. I'm really not.
That's
that,
what I was gonna say. I was gonna say, Louis, you're not that old though, but I was just gonna let
Hey,
you ride with
I'm
that.
getting
I was gonna
old.
let you ride with it.
Black don't crack. Don't know. Hey, come on now. No, I'm older. But that being said, the reality is that when looking at the younger generation, they're really pushing us, or they're pushing society and really calling upon action on things that they care about, and they're leveraging technology to do that. Like, I have a love-hate relationship with like the Twitter warriors, but at the same time, they get out there, they make the message be known, they galvanize, they support each other, and I think that it's something for us to learn how we can leverage technology in order for us to do good within society. So what I've noticed over the past 2-3 years and ongoing is that, there's a lot of people that are leveraging these tools for the benefit of their communities. So that's how I'm seeing how equity is starting to shift just across the spectrum.
Awesome. Phil, let's bring you back up. Let's see if we got you.
Can you hear me now?
Yep, I got you. I can hear you now.
Yeah, I mean, look, I think we're living through a moment of transformation on mental health. I think that, on one hand, people might say that the pandemic was terrible for mental health equity, because it made it a lot more difficult in some ways to access mental health services. It drove up isolation and loneliness. There's a lot of elements that made it worse. On the other hand, with profound changes in the use of digital for sort of globalizing access to mental health services. And I think if you look at the category as a whole, I think when the history book is written, people will end up saying that on mental health, the pandemic was transformational in moving this issue from an issue that should have been prioritized but was overlooked into center stage in an entirely new way. And even if you just look at the health tech space as an example, in 2014, the amount of venture funding for mental health tech startups was 140 million. In 2021, 7 years later, we crossed $5.5 billion. It was one of the hottest areas in health tech. And the vast majority of funding that's going into the space from venture funds is not to late stage companies that are about to IPO, they're to early stage companies. So we've got a decade ahead of us of runway of entrepreneurs coming into the space, social entrepreneurs, philanthropists, venture funds. And what my hope is that we're able to think about how we use technology to force multiply the impact of what is essentially a fundamental shortage of mental health professionals in this country. But I think
you, Louis, and Rego need to get together between the design and the tech and the ideas. Could really create something there for sure.
Exactly. I couldn't agree more. I'm actually mentally noting how to connect literally right after this call.
Oh, Rego, I know you are. I was like, Rego, it's okay. I'll send everything to you in your inbox so you have all the connections you need.
Awesome.
Yeah, I do want to bring you up one more time, Rego, though, just because I just think that people don't know all of the things that Walgreens is doing. I know you kind of lightly touched on the fact that you're becoming a healthcare company, but can you just expound on that just a little bit more? Because, again, people still kind of think of it, I think, as a pharmacy or / maybe convenience store.
Yeah, I mean, I guess what I would say to that, which is to say that there's a bright future ahead of us as a healthcare company. So we're bringing new lines of business to the marketplace, new tools and services that are, both digital and physical. And it is kind of like we're in that moment. It's an inflection moment for us, really coming out of the pandemic, realizing that the pandemic did us a lot of good in turning our head, right? Sort of just really getting our sort of intent right around our patients and customers and thinking about them in a different way. And so what I would say is that it's all to come, right? We have a new health strategy that's about to be rolled out across the portfolio, around 9,000 stores. We have new services. We have
Now, is it going to be
new-
9,000 stores in all communities?
It's the intent is to roll out our health strategy across all touch points, so
Okay.
digital and physical.
Okay.
And I mean, that's like, again, I go back to the scale. We actually are at the size where we can materially positively affect health outcomes in all communities. But our specific emphasis really is in those that are underserved and in need. That's the exciting part, that we are launching a Walgreens health service, which TBD, you guys will all see it soon. It's being piloted now in 2 states, New Jersey and California. And so I guess, the headline coming out of this part of my talk is that we understand that we can't make our communities across the board healthier without access and affordability in mind. And those are the 2 key features that are going to come together. And you guys will soon see a new Walgreens in a way that you've never seen us before.
I'm excited. I can't wait. I want to ask you a little bit less from the health side, but since we have you here and you're a creative, tell us a little bit about some of the things that Walgreens is doing with your team in particular in terms of being inclusive, and also what Walgreens is doing as a whole for like minority companies, because I think some of that's not known.
Sure. Yeah. I think the last time that we talked, I was just brought into the fold. We actually have a underserved entrepreneur program. It's an incubator program that is really focused on Black and Brown communities and entrepreneurs out of those communities. It is called Top Shelf. And I like I said, it was a program that sat very deeply underneath the radar of most folks.
I was so excited when I heard about it. I was like, what?
and we are turning it out. We're actually turning it out this month, right? So we're going to launch the announcement of this program as a bigger piece of our intent to
You all heard it first here at Just Add Flava, by the way. Next month.
It's true. It's true. The program that we're running is called Shelf Life, which is all about showcasing folks that are going through the incubator program. I forgot what the other part of the question was.
Oh, the other part of the question is, what are you doing with your team in particular to make sure that you have diversity and including people?
Yeah. So using I mentioned it earlier, I alluded to the writer's room concept, which was a test to see if we could actually deliver, getting all kinds of different voices in a room. We are now thinking beyond our base of Chicago and pulling in teams and talent from all over the country, right? So it may sound like a little thing, but it's an actual big thing for a company that is 120 years old, to think beyond our own, sort of local community, to make sure that we're attracting, bringing talent on that doesn't look like us, doesn't have the same experience as us. And we're going outside of marketing and advertising as well, right? So thinking about the specialty needs that we have as we grow into this healthcare organization, and bringing folks into the fold that may not have a traditional path into advertising or marketing, and then sort of bringing them up in through almost an incubator program inside of creative, right? So training them in the traditional ways, but really opening space for them to be their 100% self, and deliver what they know from their own experience in a way that again is new to Walgreens, and I think quite honestly new to a lot of in-house teams, right? Like taking the risk and learning.
Awesome. Well, thank you for that. And thank you all for joining. Thank you, Dr. Pryor, for the knowledge over health equity in general. Thank you about intersectionality, Phil and Louis with technology. We appreciate you all being here and hope to have you all again. I will definitely get everybody connected for the partnerships. Yes, Rego.
We are hiring, by the way. So anyone who is looking for work on this team, please reach out to me through Brandee, I guess. You'll help me do that, right? And I'm going to get
you connected with Dear Black Talent as well. So we're going to have all of that come together for sure. Thank you. Okay, everybody in the audience, it is time for our breakout sessions. So please don't leave. look on your platform there and hop in. And if you look to the left, you'll see an area that says sessions. If you click on the sessions, you'll have the option to choose from Bruh, Get Checked, which is a safe space for men to talk about their healthcare, Sis, You Good, a safe space for women to talk about their healthcare, and Checking In, a safe space for talking about mental health. So please join us in the breakouts. Hop over there to sessions on the left side of your screen, and we will see you there.